World markets remain in turmoil as a result of President Donald Trump's global trade tariffs. And yesterday, Prime Minister Keir Starmer once again ruled out tax hikes on working people. But how will he keep Britain afloat and fight back against these tariffs and deal with also the increasing pressure on the public finances that the Chancellor is now facing?
Yeah, well, Health Secretary Wes Streeting joins us now. A very good morning to you. I know you want to talk to us about recruiting more GPs. You've got 1,500 or so more, which is important. For those who at 8 o'clock were trying to get an appointment, it'll be important to them. But let's talk about global matters first, because it's all related, isn't it? One of the issues that is now raising its head once again, and it's been around since Donald Trump first came to power, was for any free trade deal, which is what Sir Keir Starmer is banking our future economic security on, essentially, around this turmoil, is the NHS access for American pharmaceuticals to the NHS, to us here, going to be part of a negotiation for a free trade deal?
Good morning. Well, our NHS is not for sale. We've always been clear about that, and it won't surprise you to know that a Labour government feels that particularly strongly. What we do want to do is make sure that, despite being at the best end of President Trump's tariff regime at the moment, we know that's going to still come at real pain for British industry and cost the British economy. We want an economic partnership agreement, and we are working as fast as we can to see if we can secure that outcome for our country. I mean, in terms of what the Prime Minister announced this week on life sciences and the NHS, we're establishing a new health data research service. This will combine the best of British science with our National Health Service so that we can be at the forefront of what I think is one of the most exciting revolutions taking place around new treatments, new technology, so that we can do for cancer what we did for COVID, groundbreaking treatments delivered at pace. And of course, therein lies a big opportunity for our country. The key thing is we've got to make sure that we own our data, that we as patients are in charge of who can access our data, and that our data is held securely, it's used ethically, and that we derive the public benefit from that data. Those are the principles that underpin the NHS, and those are the principles that will underpin our National Data Research Service too.
Just to be clear, the NHS is an absolute red line, is it? In that if Donald Trump and his team were to say it is on the basis of us getting access to the NHS that we can agree a free trade deal, we would forego a free trade deal with America?
Well, the NHS is not up for sale. It's not part of the trade negotiations. That's not where we are. And the NHS is a publicly funded public service, free at the point of use. It will always stay that way with Labour.
Can I ask you, Wes Streeting, because you're very clear on that. You've been clear that you're not going to weaken food standards for an American trade deal. Daily Mail is saying you should drop your net zero targets. You won't do that. Keir Starmer says no change in the fiscal rules. You don't want to raise taxes. He said yesterday that we're in a time of fundamental change. Attempting to manage crises without fundamental change just leads to managed decline. I think the question we're all asking is, what is the fundamental change this week Keir Starmer is setting out to deal with this economic crisis? Because everything you tell us is about what you're not going to do.
So a few things. Firstly, we've already ensured that even with the tariff regime from the States as it is, we're at the best end of that, and we are working with our counterparts in the United States to break down remaining trade barriers and to secure an economic partnership. We're also looking at the rest of the world, whether it's our nearest and largest trading partner in the European Union or the wider global marketplace, that we are breaking down barriers to trade, that we are standing for open, free trade. And thirdly, to make sure that we support industry here at home. That's why the announcements yesterday around the car industry were so important and timely. The announcement to support UK life sciences, very timely and important for that key sector of our economy. And then in June, we will be publishing not just the the spending review from the Chancellor, but also our industrial strategy, of which Life Sciences Sector Plan will be part of that. So what you're seeing from this government is the kind of industrial activism domestically so that we can start to grow our economy, provide good, well-paid, high-skilled jobs in every part of the country, not just London and the South East. And that's why what we're doing on life sciences is so important, because that's not just London, Oxford and Cambridge, it's places like Stevenage, Leeds, Liverpool. So there is a wider national benefit here.
Problem is, Wes Streeting, I have to say, none of that sounds like fundamental change. I mean, a trade deal with India, 2% of our trade. The idea that we're going to get a great trade deal with Donald Trump, he's actually wanting to put up trade barriers. The industrial policy, well, there's no money for industrial support really this year in the budgets that Rachel Reeves has. A fundamental change might be rethinking our relationship with the European Union. You don't want to do that. When Keir Starmer says attempting to manage crises without fundamental change just leads to managed decline, I mean, surely you have to rise to that and say, this is one thing which is a fundamental change. What is it?
Well, as I say, with our trading relationships, for example, with the European Union, the question of Britain's membership of the European Union is settled. It's been settled by a referendum and a number of general elections now since that referendum took place. But there's more we can do to break down the trading barriers between us and our nearest and largest trading partner. That's not just in Britain's national interest, it's also in the European Union's interests. And our interests aren't just about trade and economic cooperation, they're also about defence and security. It's in the European Union's interest.
At the moment, stock markets are falling. We may be going into recession. And the question people want to know is, if the economy is going into recession, what are you going to do? What's the action which Keir Starmer can take in Britain and around the world to stop this slide into recession? And frankly, a small trade deal here or a life sciences deal is not going to rise to the scale of this challenge.
Well, I think what you've seen from Keir Starmer since the outbreak of this disruption and turbulence has been cool, calm, level-headed leadership. It's already put us at the best end of the US's tariff regime, and there is more to do, and there is ongoing dialogue and talks to try and break down further those trade barriers between the UK and the United States. We've been working intensively for months now ahead of all of this. All of these issues with US tariffs to improve our trading relationship with the European Union, which is our nearest and largest trading partner. Yeah. And I think with all of the disruption we're seeing and a return to protectionism in the United States, I think there's an opportunity for the rest of the world to go harder on open free trade. That's where we are, as well as supporting industry here at home and rebuilding our public services. And
rebuilding public services means recruiting more GPs, and which is what you want to talk about also. There is another 1,500 or so that have been recruited. You've released some money into GP practices to help them financially give jobs to these new graduates. But we are still, when we compare our ratio, way down the list. For every 1,000 people in the UK, there is less than one qualified GP. Go to Portugal, there are 3 family doctors per 1,000 people. What are you going to do about that?
Yeah, so look, today's news is very much in that context. So it's important that I report back and say the 1,000 more GPs that I promised by the end of March, we've delivered. In fact, there's just over 1,500, so we've done more than we said we would. That's the first point of reassurance. But secondly, I also want to reassure people we're not complacent. And while the NHS is on the road to recovery, there's still a long road ahead. And there will be people this morning who are struggling to get a GP appointment. And those figures you've just cited demonstrate the scale of the mountain that we're still to climb. That's why the £889 million that we announced for general practice specifically as a result of the Chancellor's budget, the new deal we've signed with GPs, which isn't just about investment, but also about reform, is really important. Right. And when we publish our 10-year plan for health in June, that will also underscore our commitment to making the National Health Service as much a neighbourhood health service. So lots done, but lots more to do.
Appreciated.